Hello, everybody, and welcome to Getting APIs to Work. Today, we say hello to Mark Boyd of Platformable. Hey, Mark, how are you
Hey
doing?
there. G'day, Eric.
Thanks for joining. The topic that we'll talk about today is whether or how exactly open health and open banking have things in common. And I find that fascinating because open banking has seen such an insane momentum in the last couple of years. And I think open health is definitely catching up. And then you've been focusing on open health for a while. And when we talked beforehand, right, you were very enthusiastic about like open health's potential, let's say. How is your view on that? Like, why did you think that this would be a good topic to choose and a good discussion to have?
I think it's one of those areas where, like with open banking and open finance, what we've seen is regulations played a role in order to advance innovation in a field. And then there's pros and cons as far as how that's been implemented. It's about this shift which comes with APIs towards open ecosystems, I think, overall. And I guess there were a few bets that maybe open telecoms or open energy might be the next one that happens after open banking, and instead it's been open health because of the pandemic and some other reasons that really demonstrate why it's why now's the time to be focusing on the opportunities that working in partnership and working in a collaborative manner through using APIs is really going to move us forward.
So you talked about regulation, and I think that is whenever you talk about open banking, right? That is the PSD2 and now there's other countries where the same thing is happening. So regulation definitely plays a big role there. What kind of regulation do you see that are in place or are going to be in place that maybe for open health are similar to what happened in open banking?
Well, I really like, first of all, with regulation, I think one of the points I like to make is regulation is about enabling innovation. Like, I think in the past, we've looked at regulation as being a bit like how we used to see security in software design systems. It was like when it gets to security, everything's going to slow down, and it's going to mean that once you talk about security, you're not going to be able to you're not going to be able to ship your new feature or your new product because someone from the legal department is going to say, no, you can't do that or whatever. Whereas with regulate and in regulation, I think with like disruptive sectors, which is the last 20 years of or 10 years at least of technology, you've really seen this sort of idea that regulation would prevent new market entrants from getting a foothold and competing against incumbents and disrupting markets. But with technology policy, I think really it's one of those things where you want to have society trying to play catch up. Technology is always going to be ahead, but you want to have things flexible and that there be a constant communication in place that's going to be able to allow allow policy to catch up to technology a little bit closer than where it is. At the moment, we see things like we saw with face recognition, AI, for example. By the time policy caught up, a huge range of people had already been marginalized and had faced significant harms because of the rollout of the technology ahead of we're seeing that with social media platforms, So,
Yeah.
so now with regulations, though, what we've seen with open banking and open finance is that when you have regulations in place that say you, as incumbents, you must open your services via API to enable new market entrants to be able to build new products and services, it actually sparks innovation. And so now we're seeing that, I think, with open health, where there was this locked in issue with electronic health records, where a lot of the value that's in the health system is locked into what were the outcomes for the individual patient and or what were the outcomes in a clinical trial. And with COVID, what we've seen is that when you just have clinical trials, that like there's thousands of clinical trials for COVID, you can't actually transfer the findings of one to another because each study is like 1,000 people, 10,000 people at the most. You really need to have them at a much larger population size. So you need to be able to have an API that's connecting all of these different smaller clinical trials, pulling the data, making it normalized so that it is comparable. And then once you've got that population size of data, you can then start looking at what's vaccines, what's effective treatments, those sorts of ideas. So we've seen that, if you have some sort of regulation that encourages this data sharing via API, you could actually spur that sort of new innovation,
I like the way how you frame regulation as something positive. And I'm totally on board with that, right? But I think it's interesting to see that maybe not too long ago, most people would have said regulation is kind of, at least it's not exciting, right? It's like maybe it makes things safe and keeps bad things from happening, but it wouldn't be so much something where people say, oh, this makes good things happening, right? And I think with all the data and technology stuff now, we see that having open ecosystem and having open systems can be a huge advantage, but you have to make sure that it can actually happen. And one of the things I find interesting is that regulation is just the way how you say, okay, you guys must open up something, for example. But then the question is how, right? And in PSD2, I think we had this funny thing, which took me actually a while to fully grasp, that they didn't really specify exactly how it had to be done, right? It said, okay, you have to open this and this and this, but not exactly how. And that would be the realm of standards. So what I'm wondering is, how do you compare those two things where in open banking, at least I think in most cases, it was mostly the regulation, I think, that kicked things off, not so much standardization. How is that in open health? Is that a similar picture, or do you see that playing out differently?
I want to see it play out exactly the same. So the issue with PSD2 has been that Europe wasn't strong on setting what those API standards should be. If you look at the difference between the UK, Brazil, and Europe, then Brazil and UK both have said, when they've introduced the regulation, they've said, and you must build your APIs to this templated API standard for this one's for payments, this one's for account transactions or whatever. And then that has meant that all of these fintech have been able to build consistent APIs or build consistent products rather, that then integrate with every single bank, because every single bank has built the API in the same way because they've used that template. In Europe, it was based on technology standards, RTS, regulatory technology standards, which is sort of more like guidelines. Your API must involve this and must have this sort of thing. So instead, every single bank did it slightly differently. So the real only innovation you've seen so far in Europe is all of the API aggregator platforms that have been able to be introduced that's going to normalize all of those individual banks. So
you could see it positively and say, well, that's a whole new market we opened up, right? Like the aggregator business. But it also introduces delay, right?
It introduces delay. And I mean, Europe loves that thing. It's like, how can we add another layer of bureaucracy in between these two things? So, I mean, it sort of suits the worldview here. But in seriousness, though, like with open health, we can already look at a model where standards have enabled some advances of innovation. If you look in the US, they use the Fast Health Interoperability Resource API standard. They said that, so the US government has said everyone who's providing software technology that is moving electronic health records must use the FHIR or FHIR API standard when they're using that. And if you don't, you can't get Medicare or Medicaid funding for your software. You can't be listed on the preferred suppliers lists of software technology. So it's pushed all of the providers to be able to doing that. But as a result, you've got this instant interoperability of standards. Now, there's still issues, like Alyssa Knight has done some amazing work on identifying the security gaps in some FHIR API standards, but that's more about the implementation. Like, having the API standard there in the first place has meant that there's been this whole growth of software technologies, new tools that have looked at population health dynamics, looked at how do you improve efficiency of health services, which we're going to need to look at globally, because we've got climate crisis risks on health. We've got aging populations in a lot of European cities, for example. There's a whole range of pressures on the health system that's going to require a much greater optimization, as well as the sort of personalized healthcare that we've now expected from digital architecture overall, where in whatever service you use, you want to be able, whether it be in banking or health or just a personal lifestyle choice, you still need to be able, you still want to be able to personalize that experience. So, like we're going to be requiring all of like that level of flexibility in our systems going forward.
So that to me sounds as if you would probably be a proponent of saying, like, if you do regulation, you should also do standardization to make it more effective.
I'm a 100% behind open standards.
Okay.
And so the problem in Europe that we've got FHIR API standard, great standard. The problem is it was sort of designed for the US healthcare system, which is largely based on you're organizing who gets paid because it's a private healthcare system. So it's not, they haven't got universal healthcare, and it's all really about trying to apportion all that. So it's more administrative in focus rather than public health focused as far as what are the health outcomes for populations. I mean, you can get that out of FHIR, but it's not principally what it's for. So importing that and using it in Europe or anywhere else in the world, there's going to be some challenges, although it's been used effectively. Germany did some great work at the start of COVID where they were able to use the FHIR API standard to be able to allocate hospital beds for patients, those sorts of things. But still, it's more, again, it's on that administrative optimization of resources rather than the healthcare outcomes, like I say. In Europe, there's SNOMED as a standard that's been used, but they're proprietary standards. They are incredibly costly for a government to be able to ensure that everyone in the healthcare system is conforming to that sort of health data standard. So as a result, you see in several countries, there's the push away from, like Germany, for example. I think they're using SNOMED for some pilot projects, but it's just too costly to be able to have all of the healthcare providers in their country using that standard. So, like I'm a big proponent not only of regulations, but of open standards, where the standard is freely available to use by all market entrants, because also you see the new market entrants, again, this disruptive capability of startups, you're locking them out of being involved. And if they want to get involved, they're like, we'll worry about standardizing our work later on. Let's just build our sort of nimble solution using our own data model, and then you've got further fragmentation, in the system.
Yeah, I think getting standards right is always a tricky thing, right? I think it's always, I'm old enough. I don't know what you did by back then, but I'm old enough to remember those standards wars, even between like the internet standards and ISO, OSI. Is that something you've seen like a million years ago?
Yeah, I still keep an eye on the ISO standards. There's a great speaker, Carl Malmud, talks about the need to open up a lot of those proprietary standards. That work still needs to be done.
But it's just so fascinating to look at the world of standards and see that it's mostly failed things, right? I mean, on the one hand, I think we have wonderful success stories for open standards, and it's great that they work, right? But it also seems to me that like creating a good standard it's a really hard thing, and it also takes probably some luck and some timing and also some regulation around it, right? And like the market has to be big enough to be attractive for others. So you've been in the game long enough, right? So I think you are really kind of bullish on this open health thing. So do you think like there is like some maybe of these critical little things missing where you would say that part worries me a little bit? If that thing would also change, then maybe the whole space could advance. Like what would be the things that you think may be holding back things just a little?
Look, so I do think we need. What I think we need regulations saying yes. We need to expose data through global sort of free trade of or free and open data flows. There are areas like health and finance where you can't just say turn it all into open data. There's got to be some controls because you've got privacy of individuals' data. Europe's very lucky. It's got the GDPR, which there are some issues around how that's interpreted at a country level, but it's a great framework for ensuring that you can have your innovation while also having your privacy regulation. And a good example of that where policy has kept up with the technology, and now there's still some work to do, but it brought it much closer together rather than that social media platform experiment where we're like, oh my God, like all of these dangers that we didn't see coming. And now how do we put that back in the box? But so I think there is all of that. But I think what we're learning through, and this is where I'm a big one also on APIs are pretty much always the answer. So not only are APIs the answer as far as the standards, but it's the APIs are the tail wagging the dog. So APIs force platform thinking and facilitation of different stakeholders. So which, if you can get them together, then that's going to help encourage groups of stakeholders to agree to different standards. So I think that there's a new sort of approach that platform thinking encourages in and of itself towards standards.
So just in general, I would like to point out that I did not pay Mark to say that APIs are the solution to all problems. But thank you very much. I agree. No, but I think what you said is even more interesting, like in terms of the platform stuff, right? I think this is something that is still a little bit, I would say, people are starting to understand like how closely these things are intertwined, right? That if you open things up, then you do that through APIs. If you have APIs, then you have these scenarios where you can have many kind of parties participating, doing stuff, so forth. And then you kind of get this platform dynamic, which can be amazing. And I think this is really where we still think, or we need to think people more in terms of platforms, right? It's like what pieces are missing in my platform picture, basically, to really get it going. And I think that is where things get really interesting.
Yeah, absolutely. And I think then when you look at sort of areas like, so the big issue then is areas like banking, health, when we see this come up with energy next, like these areas, we need the open ecosystems because now, one, we're moving to digital infrastructure. So everything needs to be done digitally. There's globalization, so there's a lot more connection globally. We've got globally distributed architecture, so business can operate anywhere in any market. So there's all of those sorts of things, but also the problems and the issues that are facing society more generally, again, as we've seen with the pandemic and as we're starting to see with climate crisis, is that these are complex problems that are going to need to involve a wider range of stakeholders working together on solutions. And so they need a common language to be able to work together, share data in a ways that the data is going to be used, not just share data, share services, payments infrastructure, all of the rest that's going to enable that sort of creative solutions to emerge together. And I think that, platform thinking, APIs, they're the building blocks that enable that sort of new collaborative approach to occur across borders and to be able to really, and it can be done in a way that still enables, the great capitalist experiment of like, you can still have commercial opportunities in all of that. But, and the other issue with all of this is that, and another thing, is that with open ecosystems is when we're doing this and with standards, with this new collaborative approach of like solving complex problems together, then we also need to be able to look to see, are we reducing the risk of people being locked out in the same way? Like banks, there's an incredible number of people, 3 billion worldwide or something, that are unbanked. So open banking and open finance is creating new financially inclusive opportunities. So we've got to make sure, though, that we don't end up replicating those mistakes of the past, where in the future, open finance then locks out certain people. And open health, one of the benefits is that it's going to be able to enable, you to drill down, like I was saying with that cohort studies with clinical trials for COVID. But there are other areas where the population size has been so small or has been so marginalized that no one knows what works for an overweight Black person over the age of 55, because no one's been collecting that data sufficiently to be able to compare it and share that for personalized medicine for someone else. But now if we pull the data, then we're able to do that sort of thing. But we need to do it in a way that also protects, to make sure that we're not saying raise their insurance premiums. So there's that sort of privacy versus, health benefit that needs to come along with all of this.
So I think you are. What
are you going to solve all of that?
Yeah, I was like, well, there's stuff to be done. But I think you're just pointing out so many interesting things, right? And that was the last thing that I wanted to bring up, and I think you've already covered that pretty much. It's that, what also struck me when you were first talking about this, like open health is the new open banking, right? Is that the market size, or whatever you would like to call it, right? The opportunity that is there. It's like everybody, in the same way that pretty much everybody needs open banking or needs, some kind of financial mechanical stuff to be around, right? And the same is true for open health. I mean, a lot of people don't have access to it, but ideally everybody should. And I think there is just so much potential, and the market, or whatever you call it, is so big that I really hope you're right in your enthusiasm. And I also think there are a lot of upsides that we can gain, right? If we break up those barriers that we have and make things a little bit easier to share. And the last thing that you also said that I loved is where you, at some point you said, we need open data. No, we actually need open APIs. And I always think that is really that's dear to my heart, right? Because I always think that, yes, open data is good, but data is it's just the starting point, right? We need to be able to do stuff, and data can help you to do stuff, but then you actually need to do it. And for this, you need to have APIs where you can transact and do all these kind of things. So we need to see that kind of platform coming into place, and not just sharing data and then what now? So for me, that's always one of the things where I think that, yes, open data is good, but it's just the starting point.
Yeah, absolutely.
So when you see the open health things, where would you say we are in terms of where open banking was, like just at the beginning, like the good old hype curve? Where are we on the hype curve?
I think we're at the beginning, because there's the other issue with open health, and this comes in with open banking a little bit as well. I think it's not fully solved with open banking, but that's consent processes. So with open banking, it's kind of a little bit easier in that, there's still a lot of dark patterns in the data sharing in open banking, but generally, if you're wanting to use a budgeting app or a carbon calculator that lets you know how much your CO2 footprint is based on your expenditure, you can actually you get the app, and then you can say in the app, yes, I want to connect that to my bank account, and it says, if you do this, you're going to be sharing this level of data and this level of data. That's not going to be possible in open health, where it's like those, I think early on, remember when there was the whole idea that in Google you could go in and you can switch on and off which service is getting which part of your data, but there are hundreds, if not thousands, of rows now that you're meant to just sit there and toggle yes, no, and so we can't have that system with open health data sharing. So we're going to need some sort of new social contract, and again, this is where the technology is ahead of the policy. So we haven't really had these community debates yet around, okay, how much am I willing to share my health data? How do I put a ring fence around it so I know that it's being shared for social good and isn't being used for resetting my insurance premiums, sort of thing, rather than for, so they need, but we can't decide that on an individual basis, like everyone knocking at the door, hey, we want to use your data for this
for those 128 things. That it really reminds me, I can't look it up now, but it reminds me like a little while ago on my iPhone, right? I looked up and it was something like advanced privacy settings or something. And the level of control you have was amazing, but it was also something where you would clearly say nobody has any idea, A, what that all means, and B, can make an informed decision on like how to move those 150 little sliders left or right. Right. So at some point, like you said, right, technology allows me to control these things on a super granular level, but that doesn't really solve, kind of speak, the problem of people wanting some control, but then also they have to be able to actually exercise this control in a meaningful way. Right. Exactly. And I think that's for me, the tricky part. It's like, how do you do that? Like, do you just have kind of blanket things, right? Like, I choose the bronze plan or the silver plan or the gold plan or whatever. I don't know how it plays out.
Look, there are some approaches. So, for example, in research agenda globally, there's this idea that you can actually give consent for like broad principles around how your data will be used for research, but it's like tied to specific goals in the research agenda rather than you can use my data to explore what's possible, sort of thing, which people don't feel comfortable with that level. So, I think it's when you ask what point of the hype curve it's at the very beginning, but it's also like that so it's a few things in, I think regulations and standards help to set the parameters around that and put some guardrails in place. But then along with that platform, just as much as we need that multi-stakeholder facilitation where everyone's getting together and deciding on standards, which is a new type of a relationship that we haven't really seen in competitive industries before. So it's something new to have to figure out how to have that sort of what do they call it? Collaborative competition sort of model, co-opetition, I think. So where you sort of collaborating sometimes, for example, on standards, but you're competing directly on other levels. So there's that, but then there's also that participatory part where we need as a society to be talking about, as we move to digital ecosystems, what does this mean for who gets to participate and co-create, and how do we then not get to a granular level? And you'd think things like AI will be able to help us with that. If you go to your Apple phone and you ask Siri to make recommendations for which apps you should turn your notifications on, Siri's idea is turn them all on. Like, that's literally what. So I don't know how. This is Apple. You'd think they've got AI advanced enough that would say you've been using this, and this app, so turn those ones on. But no, it's like, and that's what we're still right at that point of the hype curve where we're not able to move beyond that granular basis because we haven't had those discussions yet.
No, I think you're right there. I think we're only getting started. Hey, Mark, thank you so much. I think these are fascinating, not just insights, but also perspectives on where the whole space is going. I think it is going to be a very, very dynamic space. And to put you on the spot, I hope that you will be able to join us I'd love to also do an interview about FHIR, like diving a little bit deeper, because you had like some pretty interesting insights there around the kind of the focus and the limitations of FHIR. So maybe you'll do that. But thanks for joining today. It was a lot of fun. And I think it really is something where we'll see a lot of development in that space in the next couple of years.
It's always great to chat. Thanks. And thanks everyone for joining us.
Yeah, thanks everybody, and see you next time. Bye-bye.